Hello, friends. Welcome to Creative Medicine. In this lecture, we will learn about
X-ray changes in scurvy. In X-ray changes in scurvy are typically seen at the knees and the ankle. In X-ray, you can see presence of pencil-thin cortex. Trummerfield zone is seen. This Trummerfield zone is a radiolucent zone which is present below the white line of Frenkel. White line of Frenkel is also seen, and there is also Wimberger sign. Wimberger's ring and ground glass opacity is also seen in scurvy. Diagnosis and treatment of scurvy. Investigations of choice for scurvy is leukocyte or buffy coat vitamin C concentration. Leukocyte or buffy coat vitamin C concentration is the investigation of choice, but it is difficult to perform. So practically we do serum vitamin C concentration is measured. Treatment of scurvy is 100 to 200 milligrams of vitamin C is given per day in symptomatic cases. Rickets. In rickets, there is defect.
thank you and thank you for watching.